How you doing, everyone? Today we're going to talk about runner's knee or PatellaFemoral Pain Syndrome, sometimes referred to it as anterior knee pain or chondromalacia. We're going to talk about the anatomy a little bit, who develops it, why they develop it, and the most important part, wait to the end, is the 3 stages of strengthening of the knee and hip that's going to help you take care of this at home with very little equipment, so stay tuned for that. How you doing, everyone? Today we're going to talk about runner's knee or PatellaFemoral Pain Syndrome, sometimes referred to it as anterior knee pain or chondromalacia. We're going to talk about the anatomy a little bit, who develops it, why they develop it, and the most important part, wait to the end, is the 3 stages of strengthening of the knee and hip that's going to help you take care of this at home with very little equipment, so stay tuned for that. So let's first talk about the anatomy of the patellofemoral joint. Okay, the patella is our kneecap. That's depicted right here. If we take the knee right here, and we're going to reflect it back, these are the underside of the patella or kneecap. Okay, this is the patella tendon as it attaches to the tibia, this bone right here. Okay, and when we reflect back and we pull this back, this is the very end of the femur. So it's the end of this long bone here in our upper thigh that attaches the quad or thigh muscles are here, goes to the kneecap. So this surface right here, as it makes contact with the patella, okay, these here and here, that surface right here, which is what they call articular cartilage here, and the underside of the kneecap, kind of rubs together and causes some binding. Okay, so as we bend and straighten and move that knee, the patella actually kind of floats between the quadricep and the quadricep expansion and kind of floats in between that and the patella tendon. Okay, so it sits between the tendon, 2 tendons actually, okay? So anyway, so on the underside right here, this surface right here is very, very shiny. It's very smooth. It's actually smoother than ice, actually. It's that slippery and all that. And over time, this can develop into arthritic changes where we'll get arthritis as we get a little older and we have some wear and tear on our body. The interaction of this patella, okay, and the distal end of the femur, the femoral condyles, okay, so as they interact, it causes some, what they think, tracking problems, okay? And that knee basically isn't guiding and sitting in this nice little groove. And you can see this little groove here, right through here. Patella it goes through here, it kind of bangs around, okay? And it causes some, they think, irritation to those surfaces and the surrounding structure, okay? We were trying to improve that tracking by improving the strength, some range of motion and all that, but primarily we're looking at the strengthening aspect to make this change, okay? And also sometimes the belief is that there's a timing of the muscular contraction of these muscles around here to guide the knee. It's kind of a little bit off, all right? I like to make the analogy of that old dresser drawer you have, and you're pulling it out and you're yanking on it, and all of a sudden you're like, wow, it just kind of doesn't move. And we want to slide it to the side, and then it goes onto its runners, and it runs a little bit more. And when we get you a little stronger, it helps you get that patella riding a little bit more comfortably between the runners. And the runners are essentially this little notch, the trochlear groove right here, and that little notch. Everyone understand? Okay, so that's tracking of the patella. And that's basically what's going on with the runner's knee, or what's thought to go on that causes this problem. So like a lot of these injuries, why does this even start? Like, how does this start occurring? And what the thought is, a lot of this is an overuse injury. It could be a runner that changes the kind of surface he's on. He starts increasing the volume too quickly. Sometimes changing the type of surface you're running on. Maybe you're running on more of a beveled surface, going from, let's say, grass surface or like a good high school track, like a very even track, to maybe hills. There's different ways that you can start developing this condition. With the runners, it may be just increasing the intensity. You're starting to do speed work, and you've never done speed work, trying to complement your long distance runs. Okay, it can come from you can just increase the volume. You're just too much mileage. Or you add that 3rd or 4th day of running. I'm just using running as an analogy, because this can happen with cycling, hiking, any kind of repetitive motion. It just tips the scales, and everyone's kind of a little bit different on who is more resilient and who isn't. We'll see this sometimes also, like after a winter time, people start running and they go back to their original, whatever they stopped in the fall as far as running outside, they resume. And the treadmill running, even if they're in the winter, is not quite the same is running outside. So you'll get that, I call it a winter effect, where they kind of shut down in the winter and then they go right back to their original mileage, and then they start breaking down. They need a little bit more of a ramp up to get used to that volume and get used to where they were. You'll notice it too sometimes with people that get sick. They get sick for 1 or 2 weeks, they stop their training, and they keep up that volume. So there's volume, intensity, and frequency. So some of these things are contributing factors to why this kind of gets hold and starts shutting people down. So the things that we're going to address specifically are going to help with that, but we got to get back to why it occurred, the trigger. Other things to consider as well is sometimes it's a change in shoe wear. You have a shoe that was great for you, but then it started breaking down, and now you need to get a new shoe. You've got to make that transition a little earlier. Maybe that's the origin or one of the contributing factors. But listen, this is very, they call it multifactorial, fancy word for it. There's a lot of reasons why this might occur, and there's not actually one specific thing. But there is a consensus that strengthening of the knee plus hip strengthening is one of the key parts of getting past this condition. But it can be chronic, it can be going on for a while, and this program can take 6 to 8 weeks. If you've had someone that's had it for a while and it's really deconditioned and it's really stopped a lot of things, it may take longer. But that's kind of the time frame we look for to start seeing a change in how we feel for runner's knee. So as much as we talked about strengthening be one of the key pillars to making this condition or help you kind of recover from this condition, in the early stages you may need to take some anti-inflammatories just to decrease the pain in the area. Typically you don't have a lot of swelling with this condition, but a little inflammation, a little pain control, that can help you out in the short term, okay? You don't do the strengthening, it's probably not going to really help you in the long term, but in the short term, just to get a little pain under control so you're more comfortable with like walking. Sometimes people feel a lot of pain if they're sitting for long periods of time. And we want to get out of that cycle where basic things are feeling a little bit better. They used to call the sitting, excessive sitting or moviegoer's knee was one of the terms they would use for why, for this type of condition. I'll call it Netflix knee, or we'll call it now binging knee, we'll call it. But those are some of the things that can contribute, or you'll notice that they'll have problems with. There's some people that do taping in the early stages, and it's something that we're going to cover at some point in the future. Possibly a patella tracking brace can be helpful too. All these things are kind of short-term solutions that kind of break that pain cycle and start getting you a little bit more comfortable as you transition. The other thing too is there are some benefit to using a soft insert, over-the-counter soft insert, just to kind of bolster a little bit more support. Obviously you want to, there's times you need like a custom insert. If you've had orthotics made for you, you may need to go back and get them redone, if it's been a long time. As we get older too, occasionally our foot does change in size, so we actually we may need to size up as far as our typical running shoe. The running shoe that fit us in our 20s may be a little different in our 40s or 50s, so we may need a little different type of shoe to really make those differences, make running a little bit more comfortable. So those are some of the short-term things you can consider. Obviously you can ice it or heat it. I'm not a big thing that a person that say you've got to ice it. If it's really swollen painful, you can try it. It'll give a little pain relief there, but to get to the root of the problem, you really have to look at that strengthening as the next stage. Okay, so keep that in mind. Some of the studies have looked at stretching in conjunction with strengthening. I would say the pillar is really the strengthening. We need to get you stronger. That's the long-term solution. There are beliefs that working on certain areas that are a little tight, whether it be calf tightness, hamstring, IT band, quadricep, we have to address those areas. For the sake of time, I really try and narrow my treatment for my patients so they really focus on the biggest bang for the buck. So really focus on the strengthening. If they want to do the stretching and mobility work, that's fine. Sometimes just loosening it up as far as some mobility work before you do the strengthening, that's fine. But realize the core of the program is that strengthening. Now, one of the things to understand is when you're doing when we go through the 3 stages that we're going to describe, it's all right to have some mild discomfort when you're performing these exercises. You don't want to have a spike of swelling because maybe it's not the right diagnosis, especially if you're doing a self-diagnosis and you're trying to self-treat. You may have a meniscal problem or arthritis in the joint. It might be something different, okay? Also keep in mind there's other structures that can give you knee pain that gets a little confusing. You think this is a knee issue and actually it's coming from your hip, SI, or your lower back. So consider that if you're doing these exercises and just not getting better. Those things could be contributing. So in the performance of the exercises, mild discomfort doesn't last too long after performing. Sometimes you'll have a delay, 24, 48 hours, you're getting more muscular kind of fatigue or delayed onset of muscle soreness. That sometimes will occur in 2 to 3 days or 24 to 48 hours following the performance of these exercises, especially if you haven't been doing anything at all. So keep that in mind, but realize little discomfort's okay. Being completely pain-free when you do the exercises will actually just make this take a little longer. The key is a little discomfort that doesn't really set you back, and that'll keep you on the road. If you do the road that basically says it's got to be pain-free, you won't progress as quickly. Okay, all these exercises we're going to shoot for 3 sets of 10, kind of a standard kind of gym program. We're going to go upwards of 3 sets of 10, maybe upwards, as you get better at these exercises, 15 to 20 repetitions. Sometimes I'll progress after 10 if it gets really easy after 10 repetitions, or in certain cases, I'll have you do a higher repetition before adding any kind of external weight, like an ankle weight or a band or anything like that, okay? These are good because you're not really compressing the joint as much. They call open kinetic chain exercises, so you're not getting as much compression through the joint. It's a little bit better in the early stages when it's a little bit more sensitive. Okay, so the first thing I'm going to do is going to do a little towel roll here. There's a couple different versions. We want to tighten the muscles in the top here. I'm going to hold that contraction for 10 seconds, and we're going to do it about 15 times. This is a little bit different from the 3 sets of 10. We're just trying to get that contraction, the musculature on the top here, the quad, okay? And we want to push down into that towel, keeping the heel down on the floor. So tighten like this. Hold for 10 seconds, and then release it. Little pause. When you feel right, then you can go to the next one. It's good to do both at the same time. I'm showing one, but if you do both at the same time, you can also do it with the leg relatively straight. Tighten both the left and the right. As you tighten the opposite leg, let's say you just have problems on the one knee, when you tighten both and do exercises on both sides, which you should do with all these exercises, it actually helps the injured side. So sometimes we'll do that with people that are immobilized. If they have a cast on this side, we'll actually strengthen the opposite side, especially eccentric strengthening on the opposite side. And it actually helps recover faster once the cast is off or splint, or they're able to do it because of surgery that we can't do a certain exercise. Do it on the opposite side, so keep that in mind. So the first one is a quad set. Second one we're going to do is just a straight leg raise. You can lie back. Just tighten your stomach a little bit so you don't arch your back and have any movement here. You're going to keep the opposite knee a little bit bent if you want. You can do it straight depending on the person and the tolerance. And you're going to essentially tighten, bring the leg up. Some people advocate doing a little bit of a turnout. So you tighten the little muscles a little bit more on the inside of the thigh and develop those a little bit more. I'm going to start with just tightening, getting a good contraction to the height of the opposite knee and then back down. A simple straight leg raise. Okay? So the other straight leg raise, we're going to do this in all planes. I'm going to do our side lying one. You can bend the lower leg, bring the leg out, all the way up to the side like this. Try and keep it in line with your trunk here. All the way up. As soon as you feel like you're hiking, you're going to stop the motion. So all the way up, and just a slight touch, and then back up. Sometimes I even vary it. I'll do some hip circles to kind of add a little bit more time loading. In some of the discussions, you'll see certain therapists will have the person hold it for a few seconds at the top of the motion, okay? Holding for like a 5 or 10 second hold, and then back down. You could try with those variations. I think when you're getting to the top of the motion, it kind of ensures you're getting a really good contraction, the musculature working. So I can see the advantages and disadvantages of each, okay? The other one you can do is lying on your stomach, simply do an extension or hip extension. I often do this off of an exercise ball. And the next one here, which is a little awkward at times, is doing a leg raise right here and working on the adductors. So you're coming up and coming back down. A little awkward. You can even change your hip position and try it from here. Use your hands as support, all the way up like that, and then back down. So that's a few different versions of our straight leg raises. Next one is a double leg bridge or a single leg bridge. Let's say unilateral, bilateral bridge. The first one, you're going to bring your feet together a little bit. Put your hands at the side. You're simply coming up to that position. Little pause. Sometimes we'll do that isometric hold at the very top of the position and then back down. Or you can do a unilateral if it's too easy. Leg up like so, lift up, and try and really limit the rotation of the hip. Really feel like the movement's occurring from the hip girdle. Okay? And then back down. And you hit the quads a little bit. I mean, you hit other muscles, but this is really trying to work on the hip girdle and some of the rotators. All right? All right. Next one is a clam exercise. Basically, we're going to keep our feet together. A few different versions of this. You can come up to the side like that and then back down. We had a little band here. wrap it around your legs like so. I'll typically tie it off for the sake of this. I'm just going to hold it for you. Okay, you're going to simply bring the legs apart like this and really feel like the movement is initiated from your hip here, okay? So all the way back down. You don't want to roll back. You really want to keep yourself perpendicular to the surface. All the way up, little pause, and then back down, okay? And that's the clam. So this phase will be about 1 to 2 weeks, okay, depending on the person. You may be in it a little longer. If you really just had this happen and you haven't had a lot of downtime, you may jump to the next phase pretty quickly. But I would start with some of this isolated strengthening before you go to stage 2. But keep that in mind. As we go into stage 2, there may be a little overlap where we're doing the original exercises in stage 1 as we go into stage 2, and eventually we kind of phase those other exercises out in stage 1. So there's a little bit of overlap, and it's not definite. You want to get really strong, feel like you've got a good command of the exercise, you're not rushing it, okay? And obviously if you're having trouble in the stage 2 exercise, you may have to go back to stage 1 for a little longer, but it's not a setback, rather be ready for the next jump. Quick note too is these exercises should be performed 2 or 3 times a week. Some people need a little bit more recovery, and they only can do 2 times a week with like a 2-day break in between. Some people are doing like a Monday, Wednesday, Friday, 3 days. You got to find the right balance for you. If you need more recovery, add recovery, okay? And the interim days you can do kind of modify things. Like if at this point you're saying walking is comfortable, keep that cardio, keep walking. Light, bicycle riding you can do too, stationary bike. Kind of listen to it. You kind of know if you're starting to bother it in the midst of doing it. But we want to keep that cardio because we're working on the strength. We want to also work on the endurance. Okay, so strength is more they call in the body fast twitch fibers, which are a little different, and then we have slow twitch fibers. So we want to work both systems, and we want to keep that cardio until we get back to really intense cycling, intenser hiking. And maybe running, maybe just to, so realize, let's keep that in mind during these phases, even though we're emphasizing the strengthening part. Hey, if you're getting a lot of benefit out of this video so far, I want you to go and hit that like button or subscribe, but don't forget to turn on the notifications because we're going to do a ton of other videos that'll help you to stay active and moving. So keep that in mind. Off to stage 2. Okay, so these exercises, we're going to start with a forward reach. Okay, I'll show you a front view of it. You can hold on if you need to. Sometimes when you incorporate the balance, you can't use as much weight in the early stages. But if you're just starting out, you may need to just hold on. So the first one is you're going to keep a kind of a soft, straight knee. Don't lock out the knee. Okay, we're going to show you now from a front view. Let's do it standing on the left side here. So we're going to hold on to start out, and we're going to reach forward. And we're basically not getting any motion, at the knee. We're trying to get all the motion and the fulcruming at the hip. So if you look from a side view, we're reaching forward, we're doing this. And then we're coming back up. The movement and the lengthening is from the glutes and the hamstrings. Our back should stay relatively fixed and straight as you come down. And eventually you'll go further and further to the point where you can touch the ground. If you can't do it in the early stages, that's okay. If you need to do support, from this position, like a bench or even a piece of equipment in your house, or anything like that, you can hold on, and you're just doing light touch, just to, so you don't fall over. Just hold that position and then come back up. All right, keep that in mind. Don't feel like you have to just make it a balance exercise. Some people will use a dumbbell in this hand and just make it more of a strengthening exercise in that forward position. So there's a couple ways you can modify it. Next one is a squat. Now the squat is kind of ridiculed. Sometimes you can't do it in the early stages, but eventually as the knee gets a little bit more comfortable, we love to include it. Love squats, but sometimes in the early stage we just have to modify it a little bit. So sometimes we'll do a wall squat. I'm just going to demonstrate a mini squat or a zombie squat. So the first one you're going to go is put your hands out like so, and you're going to drop down, driving your knees forward and hips back and kind of collapsing just to here to here. Really just get comfortable with that movement pattern. Like I said, a little discomfort's okay as long as it doesn't really translate into a lot of pain later on. Sometimes you'll get it 24 to 48 hours after doing the exercise. So this is a mini squat. And then you can do a full depth squat. Okay, I'm a firm believer you can go as deep as you want as long as you kind of listen to the symptoms and see how you feel. Okay, if it really bothers you, just limit the range of motion. But our goal is to get into that full range of motion squat as soon as we can. Same idea, 3 sets of 10, but we want to start adding some resistance. We're getting to, we can even start with like 1 set of body weight and then maybe doing dumbbells at our side, holding them like so. maybe 5 or 10 pounds, and slowly move that up. You can do dumbbells here, or sometimes we'll take a dumbbell and hold it against our chest for more of a forward squat. So that's a great way to kind of modify it and slowly get into that fully squat. Really important, great exercise. So next one is just doing a basic step up, okay? Working on one side. Any compensation from the squat, especially if we have problems just at one knee, we kind of negate it by doing a single leg exercise. So this is a 4-inch step, okay? I'll tell people to kind of think about equal pressure through the front of the foot and the rear. Let the knee go forward and drive like you're trying to push the step down into the floor, and tighten the thigh and come back up. When you have the shortened step, this is 4 inches, this is a Reebok step. It goes in like 2-inch increments. You can add a little bit more height depending on how it feels. When it's really low like this, you really want to make sure that this lower leg doesn't push off and compensate for the leg here. Also, as we come up, we want to work on a really nice gradual lowering down. Okay, so the up phase is important, but we really want to work on that lowering phase as well. So that's our step up. So this is 4 inches and gradually move it up. At home, you can, sometimes you'll have a step outside, it's a little modified step, or if you could buy one of these, it's pretty cheap. Eventually going to a regular step. Most regular steps are somewhere between 7 and 8 inches, depending. You can measure it out and see. Same idea. Once you feel very comfortable with that and you feel good, you can start adding a dumbbell, medicine ball, little extra resistance. You can take a milk crate and put a couple things in the milk crate to get that weight to kind of mimic, kind of hold the crate, come up like so, and back down. Like we said, now we're doing one side. We want to do both. Okay, so if we're doing unilateral exercise like the forward reach or the step up, we also want to work the other side. Whatever side's injured, you're working both. And there's a crossover effect for that, so it's really important that you do that. Now, do you do these exercises with the taping or a brace and such? You can, but I really want you to get off of those eventually when you can and move away from that. And also start at this stage 2, start moving away from those anti-inflammatories if you can, especially if you don't need it. We don't want to have effects from stomach problems, and it does affect tissue healing a little bit. So the anti-inflammatories we want to get off as soon as we can. If you need them, you take them. But really go with the idea you're going to wean yourself off of those. Okay, so taping, bracing, all kind of moving away from that point. Okay. Now, a lot of people get concerned about these, but I think it's really the performance of it and the right person. Okay, so if you can't do it, or it's fine. It's just a basic lunge. Okay, I like to start off mechanically. It's a little bit gentler on the knee to start with, like a reverse lunge. So I'll start with just legs together, step back. Even we do partial range, just like the mini squats. We're just going to work on that partial range, one side, and then back up. Okay, you can alternate if you want to give more rest. You can do one side, give a little more rest. Maybe do 20, 10 on each side. Or you can do one side, less rest, drop down. And eventually, as you feel more comfortable, going lower and lower and lower, okay, depending on your balance. You could also hold on if you needed a little balance just to get the deeper lunge if you want. And slowly, you want to slowly increase that resistance. So maybe you first start out with body weight, then start adding dumbbells to the side, or even some weight in front of you, okay? But gradually move it up. Make sure you have a good warm-up. At the start of these exercise, whether it be stage 1 or stage 2, get a nice little walk, 5 or 10 minutes, get everything going, stationary bike, anything that's kind of get some physiological warming is the best. Okay, some people also like to do some dynamic warm-ups or foam rolling, that's fine, but it's really like just getting some warmth in those tissues, okay, for these exercises. Now, we showed the forward reaches before, which is a unilateral, one leg at a time. You could also incorporate some simple deadlifts, okay? There's a variety of different deadlifts. I'm not going to show sumo. I'm just going to show you my basic one that I like to have you do. You place your hands like so. Just let the weight kind of take you. Keep the knees reasonably, maybe slightly bent. We're getting that hinging at the hip. Some people advocate looking straight down or a few feet in front of you. Other people will say look up on the horizon. I like the up on the horizon because it typically puts your back in a better position. So hands like so, look forward. If you're straining your neck, you may want to keep that neutral position and look down. All we're trying to do is limit the movement at the back, so all the motion and the muscular contraction is coming from the hip and the hamstring musculature. Obviously there's other muscles that are working here, but that's where you should feel a lot of your movement. Any back discomfort you may want to change. So forward. Not even go full range, and back up and finish the movement. Make sure you get nice and upright. And that's just a type of deadlift. So the next stage, you've gotten really comfortable. You're probably around hopefully around that 4 to 6 week time period, depending on the person. It really shouldn't be time-based, it should be criteria-based. I'm feeling good, my squats are comfortable, and you slowly start phasing out those stage 1 exercises and go into, you may still be doing some of the stage 2, and then we eventually want to go to more plyometric or sport specific, okay? So we can do some vertical jumps, bilateral, kind of like this, okay? And then eventually go into unilateral jumps. And we're just going to see what that tolerance is for that joint. Essentially, when you're doing running or some of these activities, you're bounding, you're moving, you're doing a quick, explosive, ballistic movement. But that's the sport. If you're just trying to get back to hiking, you may not have to do these plyometric and sport-specific things. You want to do it for that activity. For our runners, obviously at times when we're running, we're coming down on a single leg. Okay, so we want to do some little jumping. For our skiers, we may do some lateral hopping and forward hopping, especially our mogul skiers. Want to do this side to side, maybe some forward and back. And we also can do that in single leg as well. That is it's a little bit different. I wouldn't add any external weight, like don't do this with dumbbells. Most of these should be done with just body weight. But that's some of the movement patterns we want to incorporate, binding or plyometrics. And they can really help you kind of assess, am I ready for this activity before you go out for a full run? Okay, there is a little warming up. Do the exercise, you may notice, wow, it's starting to loosen up, getting more comfortable as I'm doing the sets. Good sign. As I'm doing the exercise, it's starting to break down and getting worse. Then you're just not quite ready for that stage 3. I'd probably only do the plyometrics, not as often as the pure strengthening. Like the plyometrics, you probably want to limit to 1 or 2 times a week. That is very aggressive, and you may need more recovery for the plyometric or the stage 3 exercises. One exercise we didn't go through that you can do most times for the entirety of this is some of the trunk or stabilization exercises. One is a bird dog, okay, that's something on all fours. There's a side plank and abdominal curl up. These are often referred to the McGill's top 3. I give them out for some people oftentimes that are having any kind of back discomfort. They're early kind of basic fundamental movement patterns and really work on core stability and also hip as well. So it's got some carryover and a little quad as well. They do have some carryover. So check out my video on my top 3 trunk exercises, which I'll put either in the links here or at the end of the video. Okay, so we'll include that in, and that can be done at any stage. So remember, if you're enjoying this, you're getting some benefit from it, subscribe, like it, and place a comment if you have a particular question about what we were talking about so we can clarify some points. Most importantly, if you're having trouble, consult with a physical therapist to give you a really individualized, customized program if you have any trouble. But none of these extras should make your condition worse, okay? Good luck.